What's up, guys? Hey, Jared Beckstrand here, doctor of physical therapy, toneandtighten.com. Do you suffer from tension or stiffness in your neck or back? These conditions could be alleviated with an adjustment or mobilization to these areas. So today I wanted to show you 5 of my favorite techniques to mobilize these spots and hopefully help you out of some of the pain that you might be experiencing. So let's get into it right now. All right, you guys, hey, thank you so much for joining me today here on Tone and Tighten. As always, I'm excited to be able to share with you a little bit about what I know about cracking your neck and cracking your back and how you can do that at home. I hope the things that I share help you guys out. As always, if you have not done so already, please take this chance to subscribe to Tone and Tighten here on YouTube. Also, if the techniques that I share offer you some relief, do me a favor, hit that thumbs up button down below. Okay, so let's jump into it. So, how to crack your own neck or back. Now, we've all been there before. The joint gets stiff, the area gets tight, and you just feel like it needs to pop. How can you do that at home? So those are the things that I want to share with you today. It's important to mention that some of these techniques that I'm showing you guys may or may not be associated with that audible crack or pop that you might be expecting with some of these. Not a bad thing. What you really want to pay attention to is how you feel before and contrast that with how you feel after some of these techniques. The goal is obviously pain relief. If we can get there with or without the crack or with or without the pop, then that we're headed in the right direction. Then that's a beneficial thing for you, for your condition. One more thing, before I show you guys how to do some of these techniques, just a quick disclaimer, you guys, there are certain conditions where you absolutely should not be mobilizing your back. It's important that you go and get your pain checked out by a doctor, a physical therapist, a chiropractor, someone who is trained in these techniques. Just to give you the green light, just to give you the go ahead, make sure that it's safe, make sure that you do have an okay condition to be performing this on yourself. The couple of things that I would absolutely never mobilize, I would never manipulate, never adjust. I don't want any radiculopathy, meaning if we're talking about your neck, I don't want any numbness, tingling, pain down into your arm or even into your shoulder. If we're talking about your lower back area, I don't want any numbness, tingling, pain down into your leg or even like down into your butt. Just an indication that something a little more significant might be at play. Some of the other conditions that we kind of shy away from mobilizing would be like an osteoarthritis, an osteoporosis, osteopenia type condition, spondylitis, spondylosis, spondylolisthesis. Those types of things I just would not necessarily mobilize. If we're talking about strictly kind of mechanical pain, joint dysfunction that just needs that little pop back into place, those things are going to respond great to some of these techniques. So please keep that in mind while we're doing this. Okay, so let's get into some of these techniques. Now, again, I mentioned that I want to show you 3 different regions: neck, mid-back, and lower back. So again, I hope some of these techniques help you guys out. Let's jump into them. All right, so my first 2 techniques are going to be for your neck. And so that pain, that tension in your neck, we might need to pop that or we might need to crack that. And so let's say that pain is over here on my right side. What I'm going to do is take my left ear over towards my left shoulder. With my left hand, I can reach up to the opposite side of my head and then just apply a little bit of some overpressure to get that joint into its end range of motion. So I just want a good stretch through that right side of the neck. Try to keep your shoulder down. And so a lot of times when people do this, they pull on it and kind of let their shoulder come up. We're trying to create separation between your ear and your shoulder. So take it to its end range, and then again, just a little bit of an overpressure. Sometimes, if you're tight enough, that can be enough to get a little bit of a pop on that side of your neck. That's technique number 1 for your cervical spine, or again, for your neck. The one that I like, it's a little bit more aggressive than that one, so if you need maybe a little bit more, what we're going to do is actually add a rotation component to it. Basically, we're going to twist that joint up and then just, again, apply a little bit of overpressure to hopefully get some of that release. And so again, if I'm painful on my right side, your first step is going to be to side bend away from it. So I'm going to initiate this side bend motion. My left ear comes down to my left shoulder, and then what I want to do is you can use your hand or even to just kind of rotate a little bit. So if I side bend left and then rotate right, I can feel a lot of pressure and I can feel just a lot of tension right in that right side of my neck. So side bend this way, side bend left, rotate right, and then with my hand, what I can do is I can come in and I just push kind of right on my chin, and then your force is directed up into that position, up into that motion. So I'm kind of at this 45-degree angle up towards the ceiling. I'm going to side bend this way, I'm going to rotate that way, and then just a little overpressure. I actually got 2 in my neck just right there. And so let's go to the other side as well. I like to keep things even. So this is gonna be for the left side of my neck. I'm gonna side bend to the right, and then I'm gonna rotate to the left. So we side bend away, rotate towards with my right hand. And again, I'm just gonna apply a little bit of pressure on my chin, pushing up at this 45-degree angle towards the ceiling. Side bend, rotate, and pop. I got 1 on that side. And so those are the 2 techniques that I like for the cervical spine. Let's get into kind of the lower or the mid-back next. All right, so I want to show you 2 techniques for your mid-back. One doesn't require any equipment, the other one does. So I'll show you kind of the easier one first. And so actually, I love to play golf, you guys. This is my kind of first T-block warm-up. Golf, obviously, we're doing a ton of rotating through the spine. I want my spine to move as much as possible. This is, again, my first T-block stretch. This is the one that I like. So what you're going to do, sit down on the ground, and then let's see, I want to face you guys. And so I'm going to rotate to the right. In order to pop that right side of my back, I'm going to cross my right leg kind of up and over my knee into this position. And then with my left elbow, I'm going to get that outside of my right knee. And so now what I can actually do is leverage and use this left elbow to push into my right knee, basically to create a little more torsion in my back. And so again, the mechanics of this are all the same. I'm going to come to here, so that's a pretty good rotation for me to get into that position. But then if I use this and kind of just push on it, there's one, I don't know if you guys heard that one. That's one way that you can do it. And so now I'm going to go back to the other side. That was on, again, kind of the right side of my back. Here, I'm going to cross the left leg over my right. Right elbow goes to the outside of my left knee. My left hand is kind of back behind me just for balance. And then we're going to go. I don't know if you guys heard that one. I hope that showed up on my audio. But I got 2 good cracks out of that. And again, I felt that one kind of right in that mid-back position. So that's, again, my first T-block stretch. That's what that one is. Next, let's grab our foam roller. You guys know how I love my foam rollers around here. I have quite a few videos showing you guys some of my favorite stretches to utilize this foam roll or one of these foam rollers to hopefully get you guys some relief. If you don't have one, they're super cheap to pick up. What I'll do is I'll leave a link in the description down below that you can go to pick up a foam roller. I recommend them to anyone. Like, they're really one of my favorite at-home kind of therapy or fitness pieces of equipment. And so what I'm going to do is I'm going to lay that down perpendicular to my spine. Don't do this one on your bed. Bed's not quite firm enough. You're going to sink into your bed. This therapy table, you'll see there's not a lot of cushion to it, so I can do it on this, but do it on your floor. That's kind of what I'd recommend here. And so you're going to sit up, and then wherever it is hurting in your back, so if it's a little bit lower, I want that foam roll to be a little bit lower. If it's a little bit higher, I want my foam roll to be a little bit higher. You're going to try to focus that foam roller right on where that spot of tension is in your back. And so let's say that I have it right here in this spot. Now, the thing about this is, as I lay here relaxed, if my shoulders are back, I'm actually rolling on my shoulder blades right now. I'm not even on my spine at all. I can feel it a little bit in my spine, but mostly my weight is supported through my shoulder blades. I want to get to your spine with this. So to do that, what you're going to do is actually just give yourself a big hug. What that does is that retracts the shoulder blades kind of up and out of the way. All of a sudden, now I can feel that foam roller squarely on my lower back. And then what you're going to do is you can just kind of rock up and back over that spot until we get some of those pops, some of those cracks, or again, the goal is to just realign the spine. The primary problem that I see with this is people will come in here and they'll just get so rigid and they'll just stay kind of in this straight plank position. It's important that you let your back kind of fall over the foam roller. So if I were doing this, I'd come here, and then as I come up, you'll see that I kind of arch over backwards. I'm letting that foam roller push into my spine, and my head and my shoulders are falling down towards the ground as that foam roller mobilizes each one of those spine levels. There is one way you can do this. Let me grab a chair and show it to you. All right, so in a technique very similar to the one that I just showed you guys with the foam roll, you can also do that with a chair. Again, the goal is to extend your spine over something firm to kind of help it to mobilize that specific spot. On this chair one, make sure that it's got a nice firm back. Make sure that it's got four nice sturdy legs. I don't want anything that swivels or pivots or reclines or rocks. Safety first with this, and also kind of the more sturdy the chair, the more effective the mobilization with this. And so just like what we did with the foam roller, what I'm going to do is I'm going to get the top of that chair right onto that spot in my back where I might be feeling some of that tension. You might have to kind of sit a little lower. You might have to sit a little taller, depending on how high that chair is, but you can kind of vary where you get on that spine by how tall that chair back is. From here, again, I want the shoulder blades out of the way, so I'm going to bring my elbows forward. Again, what that does is retracts the shoulder blades forward so that that spine is exposed, so that it's the spine on the chair, not my shoulder blades that are on the chair. So you're going to bring the elbows forward. I like to support my head with this one. We don't want neck pain, you guys. We want you to, we want to take care of the back pain. We don't want to create any neck pain with it. So right here, forward. And then what you're going to do is clasp your hands back behind your head, and then we're just going to extend right over that chair. Oh, man. Right there. Good. I think I got one more pop out of that one, you guys. And so, again, I'm going to vary where that is. If I scoot back a little bit, if I sit up a little straighter, elbows out forward, extend over the back. That's just one more way that you can promote a little more relaxation in that area. Okay, so those are 3 techniques for your mid-back. I've got one more technique to show you to get the crack, the mobilization out of your lower back. All right, and finally, last technique, let's show you how to get that lower back or that lumbar spine. So I'm going to lay down on my back. Let's say that I was going to mobilize that left side. And so I'm laying down on my back. My shoulders, I want my shoulders to stay flat against the floor. Again, your bed's probably a little too soft to do this one. Either a really firm bed or the floor is going to work the best to do this technique. So you're laying down. Right now my shoulders are back, my shoulders are flat against the ground, but again, what I want to do is bring my hip toward you guys. And so I'm trying to create that separation again between my hip and my shoulders. I'm trying to rotate in my spine to do that. So down nice and flat. Then what I'll tell people is, so my left knee is bent. With your right hand, you can grab the outside of your left knee, and then with your right hand, you're going to pull over into this position. Oh man, I feel like that's going to go just about right there. That's pretty tight on me to get into that position. With this, I will mention to you, the higher your knee, the higher you're going to feel this in your back. So if I bring my knee way up here high, all of a sudden I rotate higher in my lower back to get that one. If I bring my knee down here a little bit lower, you can feel that a little lower in your back. So you can kind of vary where you feel this stretch and even where you get the pop based on your knee position. Some people will say you should hook your foot back behind your knee to get it. Personally, what happens in your back is relatively independent of what's going on in your knee joint. And so hook it if it feels comfortable, but don't feel like you have to. So again, this is for the left side of my back as I'm pulling my left knee over towards you guys, over towards my right. If I wanted to even things out, I'm going to get my left leg straight, my right leg's bent, left hand is on the outside of my right knee, and now I'm just going to pull over this way. Again, the goal is to create separation between your hips and your shoulders. If you're pulling on this and if your shoulder's coming with you, you're not creating that separation. So try to keep that shoulder down as you pull. Sometimes if you even kind of bring your arm out here, gravity will assist in keeping that down until we get that good stretch in your lower back. So I'm going to take it to this point, and then again, if you want a little bit more overpressure on it, you're right here, and then you can just add a little bit of a thrust kind of down towards the floor to that top knee, and that will help it to, again, take it to that end range and even release some of that pressure that's in that joint. Okay, you guys, so there you go. 2 for your neck, 3 for your mid-back, and then 1 for your lower back. So about 6 of my favorite techniques to help you at home to crack your neck, your mid-back, and your lower back. So I hope that helps you guys out. I hope you guys find some pain relief from some of those techniques. If you do me a huge favor, hit that thumbs up button down below. Leave me a comment telling me about your experience with it. If you have any questions, leave those in a comment down below. Also, if you have any suggestions for future videos that you'd like to see from Tone and Tighten, I'd love to hear from you guys. So comment down below. I try to answer all my comments. I try to do that as soon as possible. Usually it's a couple of days, but I am trying. Again, if you haven't done so already, I hope you take the chance to subscribe to Tone and Tighten. If you know someone that this information might benefit, hit that share button down below too. You can post it on either your social media, their social media, share a link to this video. It's really easy to help out your friends and loved ones. Okay, you guys, that's it for me. Until next time, I will see you right back here on Tone and Tighten.